Hello, my name's Sarah Wombell and I'm the Senior Clinical Nurse Specialist for the Chronic Pain Services at Barking, Havant and Redbridge University Hospitals NHS Trust. So today we're going to talk about alternative therapies. So the aims of the session are to discuss a range of alternative therapies that are available to treat chronic pain conditions, to have a basic understanding of the effectiveness of these treatments, and to have an awareness of the current research surrounding alternative therapies. So when we talk about approaches to pain control, alternative medicines or therapies are treatments that fall outside of mainstream healthcare. This means they may not routinely be available on the NHS. This is because research and evidence is often inconclusive, and the quality of research can vary. Studies look at different outcomes, such as pain, fatigue, and disability, and this can make it difficult to assess the effectiveness of the treatment on the chronic pain condition. A recent survey carried out by Arthritis Research UK found that 1/4 of the UK population still use alternative treatments, and that we spend over £450 million a year on these therapies. So what alternative treatments are available for chronic pain? Let's first talk about heat therapy, and this looks at two categories based on the heat's ability to penetrate your skin and affect your underlying tissues. Now this can be done superficially on the skin via infrared heat, hot packs or hot water bottles, paraffin wax baths, or hydrotherapy. Alternatively, a specialist practitioner or physiotherapist can use shortwave and microwave diathermy, which is a high frequency electromagnetic energy which generates heat. They can also use therapeutic ultrasound. Now the benefits of heat therapy is that it increases your circulation and blood flow. It can cause your connective tissue to become more flexible. It can reduce joint stiffness, muscle spasm and pain. And it can help you to engage in rehabilitative approaches such as stretching. If we look at cold therapy, cryotherapy is a treatment that involves freezing or near freezing temperatures and was traditionally used for the treatment of acute injuries, but it's now found to be useful for chronic pain. And this can be done using ice packs, ice massage or immersion. And the benefits of cold therapy is that it helps to cool the skin surface and underlying tissues and therefore can reduce swelling. Cold therapy can also reduce inflammation, muscle spasms and pain. And when we talk about pain mechanisms, the cold therapy or cold stimulus can override your pain sensation, therefore giving you a reduction in pain. What about if we use hot and cold together? And this is called contrast therapy. It can be applied locally to your skin using hot and cold packs in alternating fashion, or using hot and cold baths to treat small or large areas of your body. The benefits of cold therapy is that it can reduce swelling and therefore give a pain relieving effect. And the cold therapy operates on your body's pain gate mechanisms, where it temporarily affects your pain signals that travel to and from your brain. Let's now talk about TENS machines. Now TENS stands for transcutaneous electrical nerve stimulation. And a TENS machine is a portable device that's connected to the skin via sticky pads called electrodes. It's a method of pain relief involving a mild electrical current. Depending on how you use the TENS machine, it can work in two different ways. Method 1, which is high frequency or called conventional TENS, electrical impulses will interfere with the pain messages between your spinal cord and the pain centres of your brain. This means the pain signal cannot travel. Using high frequency TENS, you could feel a buzzing or tingling sensation, but it's not normally painful. And when you use high frequency TENS, it tends to produce quick pain relief, but this only is effective whilst your machine is on. If we look at method 2, which is called low frequency or acupuncture TENS, this increases the production of your endorphins, which are your body's natural pain relieving chemicals. Low frequency can be slightly more unpleasant. You can get a muscle twitch, and it's described as a tapping or pulsing sensation. Low frequency TENS can take up to 20 or 30 minutes to achieve pain relief. But this pain relief can then last for up to 60 minutes once your machine is switched off. Research in regards to TENS machines is often inconclusive, but there are more studies being carried out looking at the difference between low frequency and high frequency TENS on the effect of chronic back pain. Let's now talk about acupuncture. Now, this is the practice of inserting fine needles into specific sites on the body. Chinese medicine have a belief that there's an energy or a life force called qi that flows through the body in 12 channels called meridians. The Chinese belief is when qi is blocked or doesn't flow freely through the body, this can cause illness or pain. The Chinese medicine believe that when acupuncture is used on specific meridians, it can restore the flow of qi, therefore improve health and reduce pain. Western medicine take a different approach to how acupuncture works. This involves stimulating sensory nerves under your skin and the muscles of your body. Acupuncture can affect areas of your brain that are known to reduce sensitivity to pain and stress. There's something called trigger point insertion, which can help to reduce and relax your muscles. And acupuncture can also produce endorphins, which are your body's natural pain relieving chemicals. The National Institute for Health and Care Excellence recommend that acupuncture could be used for chronic tension type headaches and migraines. This means that acupuncture can be used as an alternative therapy for other pain conditions. In regards to research, studies looking at low back pain found that they were unable to tell the difference on acupuncture and the effectiveness of it with patients with acute and chronic pain. Studies also showed that acupuncture was only effective in back pain patients for short term. Studies looking at fibromyalgia patients found that acupuncture did not improve their fatigue, sleep or function. And there was also poor evidence that acupuncture helped with their pain. Also, it was difficult to understand if the acupuncture was effective in the long term. Let's now talk about massage. This is a method of manipulating muscle and tissue using pressure, traction and touch. And depending on what type of massage you use, it can reduce pain and encourage relaxation. In regards to research, studies looking at patients with low back pain, fibromyalgia and osteoarthritis found that massage was beneficial in the short term, but looking at outcomes that involved stiffness, fatigue and the patient's quality of life. If we now talk about Chinese meditation balls or Bowding balls. These balls work on systems of acupuncture and acupressure. However, there's no current evidence supporting that Bowding balls give pain reduction. There is research looking at stress balls and how they can reduce anxiety and pain in surgery. It could be said, however, that using a Bowding ball or a stress ball could be useful in assisting your physical hand functional movements and stretches, which your physiotherapist may have advised you to do. Let's now talk about aromatherapy. Here, natural oils are extracted from flowers, bark, stem, leaves, roots, or other parts of the plant, and these are used to enhance psychological and physical well-being. These oils can be absorbed through the skin, where they travel through the bloodstream, or they could be inhaled as a vapour. Aromatherapy can be used for a variety of applications, including pain relief, mood enhancement, and increasing cognitive function. In regards to research, studies mainly look at fibromyalgia patients, and they found that aromatherapy gave no improvement in pain or disability. There's no current evidence that aromatherapy helps with back pain. There are studies that look at lavender and show when this is used with sleep hygiene, it can help to improve sleep quality. And we'll talk about this more when we do our sleep strategy session. Let's now talk about laughter therapy. Since our bodies cannot distinguish between real and fake laughter, anything that makes you giggle will have a positive impact. This means you do not have to be happy or have a sense of humour to benefit. And research shows that laughter therapy can have a significant change in the increase in production of endorphins, which we've mentioned are the body's natural pain-relieving chemicals. It can provide a full-scale workout for your muscles. It can help to reduce your stress hormones, improve your social well-being, and research has shown that laughter therapy can decrease your chronic pain. Now, laughter therapy can usually be accessed in two ways, either via laughter group workshops or laughter yoga, which can involve clapping, breathing or stretching. Let's now talk about pets or animals. Research shows these are natural mood enhancers, and having a pet can lower the level of cortisol, which is a stress hormone. Studies have shown that when patients are in contact with an animal, the production of serotonin, which is a neurotransmitter that regulates your mood and helps your well-being. Further studies have identified that owning a cat can lower your blood pressure and cholesterol levels. And one study even found that 12 minutes of dog-assisted therapy significantly reduced patients' fibromyalgia pain. And finally, let's look at music therapy. Music as a healing influence has been around since 429-423 BC. And music is thought to have a positive effect on our breathing, heart rate and blood pressure. Using music therapy can increase oxytocin levels, release serotonin and acetylcholine, and these are neurotransmitters and hormones that can have a calming effect. This means that music therapy may lower our anxiety levels and help to reduce pain. When we talk about research, studies have looked at patients with osteoarthritis and fibromyalgia and found that when they used music therapy, they had some reduction in pain, but it was unclear if the music therapy gave any long-term effects. So what do we need to do now in regards to alternative therapies for chronic pain? Here are some points I want you to consider. Think about the cost of the treatment. How long will the treatment last? Is it safe for me to use the treatment? And what side effects might the treatment cause? And we know that the use of distraction techniques can significantly improve your experience. So using simple things such as colour therapy, completing a crossword, doing a jigsaw, engaging in arts and crafts such as making jewellery or a birthday card. Anything that acts as a distraction and can encourage the release of your endorphins, which are your natural pain-relieving chemicals, can be an effective way in controlling your pain. And remember that although alternative therapies may be successful, evidence can sometimes be misleading or non-existent. And finally, if you want further information about alternative therapies, the Arthritis Research UK have produced a report looking at a range of different therapies that are available for different chronic pain conditions and the research that's available supporting these. You can also talk to your GP, or during the pain management programme you can talk to your clinical nurse specialist or your physiotherapist. I hope you enjoyed this session and thank you for listening.